Okay, so we're going to run through the entire assessment. I am going to arrive on scene, and I'm going to look around for scene safety, make sure the scene is safe, and I'm going to determine that it is safe. I'm going to make sure to have my BSI on, just to be sure of my own personal safety. And I'm going to get a general impression of the patient. The patient is lying supine. It's a male, approximately in his 20s, appears to have suffered some sort of trauma, could be head trauma, spine trauma. So I'm going to direct my partner to take spinal motion restriction, and I'm going to walk up to the patient and determine the level of consciousness. Hello, sir. Can you hear me? Are you okay? And the patient is conscious and alert. So next, I'm going to assess the airway. Patient is breathing, doesn't have anything in the way of the airway. I can listen for breath sounds, look for chest rise, and he is breathing normally. I'm going to check his circulation, get a pulse, and look at his skin color as well. His skin color is pale, cool and clammy. However, he is not bleeding very much, so we don't have to worry about the bleeding. So because he is pale, cool, and clammy, he could be suffering from some sort of shock. So we want to be sure to elevate his legs just in case, as long as there's no injury. So I can run through a rapid head-to-toe exam, check the head, back of the neck, look for tracheal deviation, tracheal distension, feel the chest, feel the 4 quadrants of the abdomen, feel the legs, check for pedal pulse, feel the other leg, check for a pedal pulse. Can also check the arms, check for pulses there as well. So it doesn't appear to be any obvious signs of injury, so I'm going to make sure to have his legs elevated. Even though this could just be psychogenic shock, we don't want to take any chances. So we'll make sure to have his legs elevated approximately around 6 inches or so. So next, we also want to make sure that the patient can stay warm. So I've got a coat here. We can just place on him like a blanket. You can use a blanket coat. We'll make sure that he's nice and covered, stay nice and warm. And we're going to want to transport the patient as soon as we can. We're going to reassess the patient every 5 minutes and check his vitals and reassess those vitals every 5 minutes just to make sure that the patient isn't getting worse and to see if he gets better at all.